I see you've done this before.
Michelle Garber.
Okay, Michelle Garber. I'm a nip tuck coach because they are casting for lots of different things.
That's true. Okay.
Yeah, this is why we're doing it today. Yep, we do it again.
Michelle Garber, the nip tuck coach.
Okay.
Michelle Garber, the nip tuck coach.
Perfect. See.
Michelle Garber, the nip tuck coach.
Hey, Michelle. So you know what the show's about and what
I
we're
do.
looking for. Okay,
I do.
great.
I do.
And from what I hear, that's something that you do. Can you tell us how you got started and what exactly do you do?
Well, I've been in the industry since about 1998, and I started off as a publicist working behind the scenes for plastic surgeons, for dermatologists, and I also experimented myself with different procedures, and I have looked like a duck. I have blown up like a blowfish. I've experimented with non-invasive breast augmentation, wearing domes that were connected to a computer. So I've had my own experience within the industry as a patient and also as a publicist for the doctors, where they want to experiment and do things on me before they do it on patients. And through all that, not only did I learn about what practice management was and what the doctors were looking for, but I also saw that the patients were sometimes, they really didn't understand what they were getting themselves into. And lots of things can happen when you start doing cosmetic work. So because my friends always knew that I was in the industry, I was asked a lot of questions all the time about who to go to, what's Botox. And I've been getting Botox since before Botox was FDA approved. And I was the first person in Connecticut to do Botox party for the doctors.
So tell me, how did you actually?
And one of the things that is really important today, that I think makes me, so here's what now I'm talking to you, or I can talk to the camera.
Talk to the camera.
Okay, so here's what makes me different from other people out there that are coaching for cosmetic surgery. First of all, there's about 7 of us worldwide that are actually doing this. And I am not a broker for the doctors. And that is what differentiates me from some of the other people that are cosmetic surgery coaches. I vet all my doctors. I do my own independent research, and my goal is to inform patients, to keep them safe, and so by the time they go to the doctor, they know what they're getting themselves into. They have a list of questions. They know the doctor, and they go in informed, and I think being an informed patient is so key today to a successful outcome, because any medical doctor is legally allowed to do.
I wouldn't go into that
no,
part.
but okay.
Oh, so you're telling me?
Yeah.
Because I think that first part was fantastic, and you seem the most comfortable.
Okay.
And because they're going to pick the doctors, and they're going to.
Right, they're going to. And then the other
to
thing
be
is
their guide, to take their hand,
to guide them, give them information,
help them with their anxiety,
with their
make
anxiety.
Sure they're well informed, being
right.
the person who answers all their questions. So by the time they get to their answer, they feel really good about it.
And that's my goal.
What you do.
Right. And that's my goal, is for them to guide them through the process, because once you make the decision to do a cosmetic procedure, there's so much information out there, and it can be extremely overwhelming, extremely anxiety provoking, very confusing. And then you have to manage your expectations, because why are you doing what you're doing? And what's the outcome going to be like?
So
there are patient coordinators and plastic surgeon concierges that work in the doctor's offices. I don't work for the doctor, so that's another differentiator. And the 7 people that do cosmetic surgery consulting, a lot of them are paid by the doctors. And I don't get paid by the doctor.
And I still, again, to sell yourself, I would say there are only 7 of us. And I know there's a reason why I'm considered one of the top consultants in this business. Boom, end of soundbite.
I like that soundbite. Okay, all right.
But be really confident. And the thing is, tell me why. We've seen a few people who do what you do, and coaches and they've been doing this for a few years. What's different about you?
Well, first of all, I think, as I said before, there's only 7 of us that are really cosmetic surgery coaches. So yes, there are a lot of people that are pretending to be cosmetic surgery coaches. A lot of them work for the doctors. So there are patient coordinators that work for the doctors that consult for the doctors with patients that walk in to tell them basically what I tell them. The difference is that I'm coming from an unbiased viewpoint. I'm also coming from a patient viewpoint.
Okay, stop. So, there are a lot of people that are saying that they're coaches, and it seems like all of a sudden it's this big business. What's the difference between you and them?
The difference is that I work for my clients. I don't work for the doctors. I work for you, being the client, and I've also been a patient as well. So that's a big difference, is where I'm coming from, and that I don't.
Do it again.
Right.
Now, there are so many people who say that they're doing this. I mean, we have had more casting people. I mean, more people, agents, people on the internet. It seems to be a big business that's happening. Why are you different? What is it that makes you unique?
The number one, what makes me unique, is that I work for the client. I don't work for the doctors. I don't get paid for from the doctors. I'm not a broker for the doctors. So I work for you, the client.
I have your best interest in mind and nothing else.
I have my client's best interest in mind, nothing else. I want them to be safe. I want them to be informed. I want them to feel comfortable. I'm kind of like a girlfriend, a research person, a little bit of a library for them.
Little part right there, right? That little part was good. But and also,
And
I want to be for them what I wish I had had for me.
And I wish, and I've gone through a lot of procedures myself, and I've had my ups and the downs, and I've looked like Spock in a blowfish and had this happen and that happen. I didn't have anyone to talk to. And
I wish I had had a Michelle.
And I wish that I had a Michelle that I could talk to. I can't tell you how many phone calls I get a month from unhappy patients that have had cosmetic surgery. And they call me and they're crying. I mean, and they didn't come to me before they made the decision, but now all of a sudden they're coming to me, and it's heartbreaking. And I really want to coach my clients to manage their expectations. It's surgery, no matter what you do. Or it could be just non-surgical procedures, but there are risks involved that they don't know. Another reason.
Okay, I'm going to stop you there because that's really good. But also the positive stuff, which is, hey, it's there are risks, but there's also
it can
really
change
good
someone's
outlines
life
in a good way. Because
right.
This is a show where they're going to try to transform and change people's lives. Right.
So there are risks, but there's so many wonderful things. It can transform someone completely when they have even just a simple thing like Botox to get rid of some of their lines between their foreheads so they don't look angry anymore. I mean, you'd be surprised.
Okay,
clients.
We don't need all that.
Yeah. Okay.
Because I think, and this is where you get to be passionate. So listen, Michelle, there are so many people who are coaches. I don't even really understand what it is you do, and what I also want to know is why are you different? What's so special about you?
So if you were my client and you came to me, first of all, I would say that I work for you. I don't work for any of the doctors. I'm not a broker. So I have your best interest in mind. It's very confusing. There's a lot of information out there, and so my job is to educate you, to keep you safe, to work through the anxieties, expectations, counsel you, be your girlfriend. You can pick up the phone if you decide to have surgery, and I can help you through the process from pre-surgery to post-surgery. And because, trust me, I've been on the other side, and I know what it feels like to be a patient. I know what it feels like to have a husband that you can't talk to about this. I know what it feels like to have daughters that don't want to hear about it.
See, and that's good, yeah.
You really, you need someone, and the doctors don't have time. You need someone that gets it. I get it. And that's why you need to hire me, and that's why I'm different. I love what I do. I understand the...
Okay, now stop.
Okay,
Go ahead.
But,
you may, yeah. Go ahead.
But I had a client that was, I had a client, a guy called me up. He was in his early 40s, and I met with him, and he was really cute, really hot. And he said, I don't know what to do, but I need to do something because I'm having difficulty meeting women. And I looked at him, it was like, really? And he said, oh, I want to do something here, and I want to do something here. And we went through all the different things and all the different procedures that were available to him. And in the end, he just wanted a perk, something that would make him feel better about himself, because he really was cute. And he ended up just getting a little bit of filler underneath his eye, and we followed up, and he just felt better. It didn't change his life dramatically, but he felt better, and he felt more confident about meeting women.
Okay, I'm going to stop you there. That I love the little story. That was so great, because also I love that he was really hot. Yeah, exactly.
He was, yeah.
But then,
he
it
was
was too long.
Okay.
Then it was too long, but I love that.
Yeah,
but also, I loved your animation.
He was so cute.
He was really hot. You know,
this is a fun story.
He was hot. I may be a married man, but he was hot.
But I got a better story than that.
Okay.
I think somehow I could weave this in. So
short though.
Okay,
and
short.
You get to be animated and show your personality.
Okay, so short. This was before a lot of fillers were being used, and this was before the FDA's approval of fillers. I had fillers here and here, and I had an allergic reaction to the fillers, and I woke up the next day looking like a blowfish. And I had a speaking engagement that I had to do like a week later, and no one knew how to get rid of the swelling because it was on a non-FDA approved surgical filler. So anyway, so I ended up getting some steroids to take down. But what was funny was that I was able to use the blowfish and how I looked when I had to do a keynote speak and integrate that into my speech, and it was funny.
It was funny.
It was
and now
funny.
I'm thinking the way they think when they edit me, I'd go for the first story.
Yeah.
But shorter, right?
But the blowfish one is kind of funny.
The blowfish one is good, but if you
I've
bring
looked
it
like a
back
blow-
to the same theme, which is, and that's
Why? If I knew if
I had a Michelle,
if I had someone that could have that I could have called and said,
That's
you know,
right.
I look like this. What happened?
Right. So in the middle of your audition, and it'll keep you.
And he was CEO of this startup company in San Francisco. He was adorable.
Yeah.
I was like, why?
But even if in the midst of this, he did a little schmoozing, and he was adorable. I'm telling you, if I
he was adorable.
Yeah, because they want personality.
Yeah, he was adorable.
Oh, I wonder what that Michelle's going to say this week on the show.
He was adorable. Okay. All right.
You came to my office.
And I've been doing, yeah. So if you came to what?
What was the question?
I get.
What is it? What
Well,
do you do
well,
that's
for
different
instance,
than
well-
I don't know the nurse at the plastic surgeons? What do you do that's different? Don't go on a rant. Just use that as a way to get into.
I work. The difference between what I do and the nurse at the plastic surgeon, first of all, is I work for the client. I work for you.
I work for you and
Only you.
Right?
I work for you and only you. I have nothing to do with the doctor. I have doctors that I refer out to, but I don't get compensated by the doctors. I do my own research because I want to make sure that you're comfortable with both the procedures that you're having done, you have the information, and that you're comfortable with the doctor, and that it's a good match for you. Mm-hmm. It's like a little bit of medical matchmaking.
And what about the part you were talking about? I love the part which is, listen, I'm your guide. I'm going to give you all the information you need.
I'm your girlfriend.
That's right.
I'm your girlfriend. I'm your research library. I'm your guide. I'm your advisor.
When your husband doesn't understand,
and I'm your trusted advisor, because trust me, I know from past experience, husbands, they don't get it. They think you're beautiful no matter what, and they don't understand it. And your daughters may not, your sons may not, your friends may not, and lots of times you don't want anyone to know.
Right, but there's
And that's the secret. And then that's the secret. And then who do you have? Who are you going to talk to? Okay, so
Right.
so I work. The difference between me and other cosmetic surgery coaches out there is that I work for you. I have your best interest in mind. I'm a little bit of a girlfriend, I'm a little bit of a research library, I'm your advisor, I'm your trusted advisor, I'm your guide, and I'm going to do also some medical matchmaking. So I'm going to educate you on your procedures. You can talk to me. I get it. I've been on both sides because trust me, sometimes your husband doesn't want to hear it, doesn't want to know about it, he thinks you're beautiful anyway. Your children may not get it. You may not want anyone to know, so you're alone.
To talk to someone.
Yeah, you're alone in this process.
But just keep it simple. But you have to talk to someone.
You have to talk.
And that someone is me.
You have to talk to somebody, and that someone is me. So it's not just.
And just stop there.
But,
There's the pause.
Okay.
No.
Okay.
There's the pause. It's too much because you don't want to lose them.
But it's support. I am not only am I guiding you, but I am supporting you through the process. You can contact me. You can email me. I'm there for you.
That's a good point to keep in
Right.
mind.
Like
how
some
you're
people
different.
are afraid. So some people are really afraid of needles. And they want to do something like Botox or fillers, but they're so afraid of just the needle in their face that they shy away from it. So that's something to get them comfortable with, that it doesn't really hurt.
I wouldn't worry about that because it's not going to happen.
So if Monica Lewinsky's standing there,
Monica Lewinsky's going to go on.
right?
They always find
Right.
the D-list
Right.
celebrities
It's
for
like-
these shows.
Yeah. So
Are they going to get, oh God.
the other one is Erin Moran from Happy Days.
Oh my gosh.
Oh my God. But she's mentally ill. That's pretty dangerous.
Well,
Oh, yeah,
she-
she's like bipolar. Michelle, did you have a safe trip?
We did. We had a lovely trip. We were in Paso Robles for 3 days.
Great. So you turned this into a little
Yeah,
vacation.
yeah. It was
Wonderful.
great.
Well, we are so happy and thrilled that you came down, and we've been looking forward to it. So you know a little bit about the show?
I do, and I am so excited, and thank you so much for the
Oh,
opportunity.
it's our pleasure. So, can you slate it for us? Can you give us, she may not say slate it, can you just look in the camera
Sure.
and give us
Sure.
your name and who you are, what you
Sure.
do?
Michelle Garber, the Nip Tuck Coach.
Great, wonderful. So Michelle, boy, I have had such an education on this
I bet.
this coaching thing. I thought, wow, you pick a plastic surgeon. So tell me a little bit what you do.
Well, I am a advisor. I am an advisor. I'm a little bit of a girlfriend. I'm a support system. I'm a medical matchmaker. I am a little bit of a coach, a little bit of a therapist. I do it all. And I work for the client.
That's wonderful. So if I'm your client, tell me why I would come to you.
Well, the main reason you would come to me is that I work for you. I don't work for the doctors. I don't get paid by the doctors. So you're coming to someone who is unbiased. I also get it. I've had my own procedures, so I understand. And I've worked in the industry for almost 20 years, and I've worked behind the scenes with the doctors as a publicist. I've worked for skincare manufacturers.
This is so perfect and fantastic, but you got to stop in case she has another question.
Okay.
But this is it. This is like day and night from when you started. Perfect.
Okay.
Absolutely perfect. So then just take a breath and stop and so tell me why you're different. There's so many of people out there like you saying they do this. Why are you different?
Well, that's a great
And
question.
even if she doesn't ask that, pretend she did and find a way to answer it.
That's a great question. There are 7 of us worldwide that do this. What makes me different is that, again, I'm not compensated by the doctors, so I'm not a beauty broker. I work for you, the client, and that is the main difference.
Right, but here's the question that I want you to answer, Michelle, which is, we've already established what your profession does. what I want you to find a way of saying to them is why you're different, meaning different from those other 7 people. So
Okay,
basically,
so I know, so the difference is, number one, I work for you. Number two, I get it. I've been in the industry for a long time. I've had procedures. I understand what you're going through from a patient's point of view. I also know how the doctors are, and I have a broad
okay,
knowledge.
yeah,
Oh,
you're not
yeah,
as connected, right?
Okay,
You could
yeah.
feel it, right?
So
Why are you
what?
different than those other 7 people? Basically, think about answering that.
Okay. So one of the main differences is that, first of all, I work for you. I'm not a broker for the doctors. And I get it. I get it from a patient perspective. I've been there. I've had no one to talk to. I've had procedures and have not had anyone to talk to. I wish there was someone like me. I wish there was someone like me that could tell me,
That could have told me.
that could have told me
What
what
I tell my clients now.
I wish there was someone like me that could have told me what I tell all my clients, that could have guided me through the process so I understood the expectations, so I knew what to do. And there isn't. You know, that's why what makes me different is that I am like a personal advisor for someone who's thinking about going through the process, which is very confusing and it's just very anxiety provoking.
Okay, and then just stop and think.
But that is the main difference, is that I don't work for the doctors, and I get it. I understand the procedures. I understand the anxiety. I know what it's like not having anyone to talk to about it. And I keep up with the latest trends. I know what's going on in the industry. And that's really important too. It's very important to have a knowledge base. So it's more than just coaching, but it's also having a knowledge base to educate you, my client, on what to expect, the real truth.
So, yeah, and I love it. That may be sometimes the most important ingredient, is that I love doing this. I wish I had had a Michelle.
Right. Okay. So what makes me different from the other cosmetic surgery coaches out there is that I work for you. You are my client. I'm not a broker. I don't get paid by the brokers. I get it. I've been there, done that. Have no one to talk to about it. Couldn't talk to my husband, couldn't talk to my daughter. So I understand what the expectations are. I understand what the doctors need from their patients. And I understand what the patients are looking for from their doctors and from someone that they can talk to, because it's a very confusing, anxiety-provoking search. And you are my client.
Okay,
and
so stop. You got to give them their girlfriend.
Right.
That's what I'm hearing. What are you guys hearing?
Right. So I am
They're going.
I am your confidant. I am your confidant. I am your support system. I am your guide. I am your research library. I am your girlfriend. I gather all the information for you so that you don't need to do it, and you have someone that you can talk to about it, because I get it, that you trust, because I've been there, done that. I wish I had a Michelle for all the times that I look like a blowfish and Dr. Spock and bruising and this and that. I didn't have anyone to talk to.
Or had unrealistic expectations.
And had unrealistic expectations.
And then just stop. And, you know, there's that one other ingredient.
It's so important to have someone to talk to before you do this.
Right.
You need it.
And I love this.
And
I have a passion for it, and I
this.
think that's what my clients feel.
And I love this. And I have a passion, and my clients feel it. Mm-hmm. And they know that they can rely on me if they need to just pick up the phone and say, hey, I don't like this little wrinkle that's going on after my facelift. We can talk about it. And I calm them down. They can't get that from the doctors. Doctors are too busy. The husbands don't get it. The husbands don't get it.
Okay, so
all right,
don't
say the doctors are too busy.
Yeah. Just say, listen, you know, the doctors.
But that's the reality.
Exactly. They'll give you.
I mean, the reality is right.
Yeah. And you don't want to be that patient who's always bugging them, but you can bug me or something like that.
Well, you know, the other thing that I find is that patients get intimidated by the doctors, and they're afraid to pick up the phone and call their doctor. So sometimes I also act as a liaison between the patient and the doctor. So if a patient calls me and says, I'm not feeling good about this, that, or the other thing.
Okay, you don't have to go into.
Sometimes, well, I did have a situation.
You don't have to go into the details,
Okay.
but say when you're telling what you can do.
But there are times that, for instance, if a underage older teenager is interested in having some cosmetic work done, there are times that I have to go between the daughter, the mother, and the father.
Fireworks there. 'Cause
Oh,
that's what
so
they
the
want.
husband, that's when the husband can't stand to look at the wife during the process after she's had a facelift because she's all bruised
Or just that there could be a big fight. This is reality TV.
Oh yeah, well, there could be that's
And
right.
I've had to
intervene in the middle when a husband puts his foot down and says, "No, you're not
gonna
doing
do
this."
And I'm taking away the car keys.
Right,
or whatever.
you're not doing this, and the wife.
Think reality TV.
Okay, so that's
you're thinking very ethical.
So that's
blah,
a good thing. And there's been times
Yeah.
that I've had to go between a husband and a wife. Husband who's crazy because his wife wants to have a facelift, and I've had to calm the husband down.
Don't even say calm it down. And I heard that maybe my insurance could pay for it, but I don't know what to do. And I mean, what would you say to me?
Well, first of all, I would say, what is it about your nose that you don't like?
Oh, I'm not really I'm too scared of my husband. Would never let me do it. Yeah.
Okay,
But that's good. Yeah. So
right.
Okay.
So what
give you
is
some
it?
good things
So
to
what
think
is it about your nose? And today the trend is really natural. In fact, I just read an article today where they're putting back bumps into noses so that they don't look like you've had any work done.
Right, but you don't have to go into that because
Right.
so this is good, which is, and then the other piece, right, with what you do is, and what are your expectations? Because I really want to help people manage their expectations.
And when you have a nose job, you've got packing and you're sore and it's a little itchy, but they don't do nose jobs like they do anymore. You don't get to look up someone's nostrils like you did in the 60s.
But I'm saying I've just asked you that question, right? Which is basically, so I'm a client, I've been thinking about this for decades. That's true, you're right.
There is, though, what does happen, and it happens quite often, especially with women after they've had a facelift, they're depressed. The expectation it's so anticlimactic, and then it's the expectations, and then it's managing the expectations, and there's a lot of depressed post-plastic surgery patients.
So that would be, if you were